Good evening, everyone. This is Kevin Niconyate, and I'm going to be presenting you the final proposal for the course Healthcare Management Information System. So, every healthcare organization must or should cope up with the latest advancement in technology nowadays, which includes online platform for data access. This advancement holds promises of efficiency, cost reduction, and improved healthcare. Although this could benefit the hospital or the medical facilities, the health information security should also be prioritized. This presentation will be focusing on the needs of the University of Washington Medicine and proposed risk analysis strategy, assess the components of the system development life cycle, determines the impact technology on decision making, evaluates the key players on strategic planning, assess the enterprise-wide data in information governance, discuss the information governance, summarize best practices and policies as related to data governance, and explain the economic impact of the proposed project. Now, the University of Washington Medicine is a 570-bed teaching hospital. It is located in the University District of Seattle, Washington, USA. Like many other medical organizations, University of Washington Medicine is devoted to fast and reliable healthcare services through the development of its health information system. Last 2018, they had experienced a data breach from a database configuration error, and the patient information is available over the Google search. Now, the data that are shown there is the laboratory tests, the names of the research or study, the patient names, the medical record number, and the description of information shared and who shared it. But this does not contain information about the medical results, the social security number, and financial information of the patient. Now the news, they need to strengthen the hospital information system security. That includes reviewing the standard operating procedures. The proposal for the University of Medicine to avoid such event in the future is generally about strengthening the security. Reviewing the SOP, MACG 2019 mentioned that when organization failed to perform technical and non-technical evaluation in response to operational changes, this could lead to data breaches. SOP of the company must include both internal and external audit or quality checks. Job alignment, determination of the department's people responsible for the information technology. Subsequently, their roles and delegation will be discussed. Educate employees and effective communication, because lack of communication within the or across the departments will also jeopardize security measures of the company. For the risk analysis, there are three tools that can be used: the HIPAA risk assessment tool, AHRQ toolkits, and the system usability scale. The HIPAA risk assessment tool is designed to help healthcare providers conduct a security risk assessment as required by HIPAA security rule and the Centers for Medicare and Medicaid Services Electronic Health Record Incentive Program. The guidance material is developed with inputs from its stakeholders and public and is updated periodically. The AHRQ toolkits and programs aims to support healthcare systems in providing quality and safe, high-value care through their core competencies, which includes health systems research, practice improvement, and data analytics. For the system usability scale, or the SUS tool, this scale is dependable tool that can be utilized by healthcare system to access or to assess usability or evaluate products and services such as the software and hardwares of the system. This is composed of 10 questions that can be answered strongly disagree or up to strongly agree. Now, the University of Medicine will use system development lifecycle as DLC principles to minimize the risk of another data breach or security breach. This is a process that a healthcare organization must undergo to determine the type of health system that will be advantageous for the company. The first phase will be the planning and analysis. Now, for the planning and analysis, it focuses on determining the problems, the objective, and the resources of the company. During this phase, it is important to examine the current system and the problems in order to identify the opportunities for improvement. After this phase, the management can decide whether to develop a new system, improve the current system, or leave the system as it is. The next phase is the design phase. The design phase considers all options for the project. Now, this phase contains or defines the elements of the system, the components, the security level that is needed within the HIS. In this system, it seeks to answer, or in this phase, it seeks to answer the questions such as, will the new system be designed in-house or will be the contract with an outsider developer? The next phase is the implementation phase, which requires significant allocation of resources in completing tasks such as conducting workflow analysis and process analysis. Installing the new system, training the staff members are also included in this phase. The last phase is the support and evaluation. It uses resources and that its end users, such as the medical staff and patients, technology, infrastructure, to maintain the support and to maintain and support the new system. In the case of University of Washington Medicine, in addressing their need for a more secure and safe hospital system, they need to have defined process in their changes or system acquisition. The event that transpired in the University of Washington Medicine was an issue of misconfiguration, which is a human error that could be prevented with SLDC. As there was a problem with the design before implementation phase in the University of Washington Medicine, it could have been noticed earlier if proper protocols and extensive testing was done before implementation, or if the support and evaluation phase was effective in monitoring and evaluating the misconfigured system. Now, the technology's impact on decision making, there is improved communication. This communication is not just only about the communication among the staff, but also include the communication from patient to its physician or medical professional. The access to patient data will be also easier and timely, and thus, since the data is easily accessible, clinical decision can be made faster too. For the patient, there will be an easier access to healthcare, such as the telemedicine, wherein the patient can access their health through or in different locations at a certain time. In telemedicine, also there is or it allows also the professionals to diagnose, order tests, and prescribe medicines online. Last is the clinical decision support, which provides the healthcare professional with information and patient-specific information that helps them in their clinical decisions. Now, health IT leaders includes Chief Information Officer, Chief Technology Officer, Chief Information Security Officer. But not all companies have these leaders within their system. Some of them have only the Chief Information Officer that functions all the three job requirements of the three leaders. For the Chief Information Officer, this or he or she is the overall manager of IT, and he has extensive knowledge of IT function of the company. He or she also have a strong executive skills that enables him or her to control the power in marketing and strategic planning of the company. Now, the chief officer should also have an empathy. This is due to the fact that health IT leaders propose a health IT project that is considered a change management project, and that it requires personnel to think differently, use different tools, and change their old habits. Next leader is the Chief Technology Officer, which is or who is responsible for tracking the latest technologies available in the market and analyzing the benefits of it in their company. The next one is the Chief Information Security Officer, who is responsible for the information and the data security. He is also included in the risk management program, arranging policies and procedure, and maintaining the regulatory compliance. Above all, there is also the health IT staffs who are responsible for actual programming, checking of the system, maintenance, repairs, and updates of the system after the introduction to the company. For the health information governance, it is defined as the principles, processes, and organizational structures that govern the IT resources. To create information governance, organization leadership must evaluate the whole process and determine what is best needed for the organization. Simply stated, data governance in healthcare is important because it is vital for caregivers and leadership to have access to the right information at the right time, at the right format. Now, the enterprise-wide data's role in healthcare information governance includes maintaining the confidentiality of patients' information, reduce of risk compliance failures and penalties, improve the quality of clinical service, streamline the planning or strategic planning, and increase operational efficiency. Health information governance initiate enterprise-wide information which focuses on data, policies, standards, and strategies. The enterprise-wide data should be flexible, user-friendly, or universal. It should be understandable by different organizations or departments. It should be transparent, and it should be also menu-driven. Technology versus enterprise-wide data. While the enterprise-wide data or information is the information shared among users, the technology is the platform wherein the enterprise-wide data is viewed and being manipulated. So without one or the other, they cannot be utilized for information governance. For the best practices, strategies, priorities, and budget. The strategy includes revisiting the SOP, defining the roles and obligation of different end users behind the program and maintenance of HIS, training the staffs, information the dissemination, increased communication through meetings. The strategy also is focusing on the compliance with HIPAA rules and regulation, and the strategies should be a team decision. Priorities create a strong management team that will oversee the whole system or whole development of the system, define the jobs and responsibilities before filling up the positions. Budget, IT leaders should also include the priorities, the budget that the company will be allocating for this project. A small medical facility, for example, CSIO and the CTO are often omitted and their function are included in the CIO. For the economic impact, healthcare organizations advance the EHR systems to meet their needs for easy integration of their EHR system with other healthcare practices in the region or hospital. However, the widespread use of EHR was delayed by high cost, data entry errors, acceptance of the physicians, and the lack of real incentives. At the University of Washington Medicine, the assessment of the change in health system and organization will be free since the HIPAA Toolkit, AHRQ, and SUS will be utilized and are free. Now, HCOs or the healthcare organization must address the issues related to data management because issues with it can cause breaches and can lead to fines and penalties. Questions for the boards that may arise is who will be the governing body in this project. The governing body, the CIO, CTO, CSO, along with the different department heads such as the finance department, nursing department, and laboratory department should be included in the governing body. They will be considered or they will be considered as representative of the departments and will include their department goal in the overall department of the hospital. Are there any unexpected costs for this project? There will be unexpected costs such as the server updates or software updates and upgrades, extra storage for patient data, and the initial productivity loss as providers and staff learn the new system. And it also require IT staff overtime to maintain the servers. Are there any training required? The later stages of development include such implementation activities as training users and modifying the organizational process in which the system will be used. Conclusion, overall, the project that aims to improve the security measure of the University of Washington Medicine is a long process, but should start with a definite and concise plan that embodies the system goals and company's goals. This plan will have to look into deeper context of health data information security and should gather more tools and programs that are evidence-based to minimize the costs and risks and thereby limiting the barriers for successful implementation of the proposed program. Risk assessment is needed. Tools like the HIPAA risk assessment tool, AHRQ toolkits, SUS tool are beneficial and economic since it is free to use. Strong leaders are needed for success of this project. The problem with University of Washington Medicine is the lack of quality control measures, especially in health information technology management, that includes change and improvements. Internal and external quality measures should be prioritized and be included in their standard operating procedures to be established. Quality control check is very important to ensure that all systems are in place and working well in protecting the PHI. Division of roles and responsibilities is a major concern in IT governance and must be determined with the help of the different stakeholders that includes finance, end user, upper management, third-party members, and even representative of the target population. These roles must then be manned with highly skilled individuals or ensure that jobs are fit for their skills or qualification.